Hello and welcome to this special show where we focus on heart health for women. Now, gender is a significant social determinant of health, and women's health is influenced not just by their biology but also by conditions like poverty, employment and family obligations. In India especially, women's health remains perhaps one of the most neglected subjects. Women's health is often viewed as just reproductive health, and a broader general definition of women's health is clearly needed. Now, heart disease is the leading cause of death in women globally, and with increased urbanization, more stress, unhealthy eating habits, women's heart health is a subject we just cannot afford to ignore. Most women even fail to recognize the symptoms of heart disease. Well, today we have with us eminent women doctors on a panel to help you understand the prevention and management of heart disease in women. Let me welcome Dr. Lily Rodriguez, who's a diabetologist with Stride Hospitals, Hyderabad, Dr. Sarita Rao, Senior Interventional Cardiologist, Director Cath Lab of Apollo Hospitals, Indore, and Dr. Benny Negalur, Consultant Diabetologist with Dr. Negalur's Diabetes and Thyroid Specialties Center Clinic, Jupiter Hospital, Thane. Thank you all for being with us. Dr. Rodriguez, let me begin with you. Heart disease is perhaps wrongly thought of as a man's disease. Just as many women now die of heart disease worldwide. But in your opinion, what are the most common heart diseases in women?
Thank you, Ankita. Thank you, NDTV and the USV for having taken up this cause in the public interest. And on 29th, we celebrate World Heart Day. And on this occasion, we are here to talk about women and heart disease. Yes, women, is it different from men? Yes, women suffer mostly. The main heart disease that women also go through is the coronary artery disease. That is the same as heart attack that happens also in men. Heart attack, or otherwise known as CAD, happens slowly over time when the sticky substance called plaque builds up within the heart blood vessels. This can happen to women as well. And then the symptom is angina or pain. And heart attacks causes blockade in the heart vessel, and that gives rise to angina. And it can also give rise to heart failure in women. And there is another condition called arrhythmias, which is the condition of rate and rhythm of heartbeats, which is also very common. This can happen to women even without a classical heart attack, so to say. And women are more likely to have silent heart attacks as compared to men. Women's symptoms may not be classical as men, and even healthcare providers may not recognize the symptoms because women are known to have small blood vessels as compared to men. And so the classical blockage of large vessel may not happen, but women can suffer from microvascular disease. And that may be difficult at times to recognize. So the most common condition is coronary artery disease in women as men also. And then there is something else called broken heart syndrome, which is particularly to women. Broken heart syndrome is a severe chest pain that is experienced by women following a very strong emotion like anger, stress, depression, things like that.
Right.
But this may not be really a heart attack, but they can suffer very much similar to a heart attack. Then something else called a variant angina,
yes,
which is also very common to women. Variant angina is pain experienced especially in the nights.
Right.
They suddenly get up with pain, but this may not be a heart attack, but still they can have pain similar to angina.
Okay.
So these are all the differences in women.
Dr. Rodriguez, thank you for that very broad sort of overview, and that really sets up our conversation going ahead, because I think you've pretty much covered broad ground here. Dr. Sarita Rao, if I can bring you in, do men and women actually experience the same symptoms associated with a heart attack?
So, Ankita, when we talk about men and women, their presentation is actually a little different.
Right.
So when we talk about symptomatology, the most common symptom which a man complains of is severe chest pain, right? It could be right, it could be left, it could be central and retrosternal. But men usually come in with symptoms of chest pain. But for a woman, she might come in with symptoms of chest pain, but her atypical symptoms are so much more. For example, she'll complain of jaw pain, or she'll complain of back pain, or maybe shoulder pain, or maybe epigastric, that is upper abdomen pain. They usually don't complain so much of chest pain. Also, a woman would complain of symptoms like, she would say, I'm just having a kind of an uneasiness, not feeling well. Or she'll complain of shortness of breath, that's difficulty in breathing. Sometimes they also complain of only indigestion or some kind of a gas kind of a feeling. Or they might just say that I'm not feeling well. So symptomatology in women is not so clear. The symptoms are atypical, difficult to pick up, and that is why heart disease and heart attacks in women, they are picked up so much later than in men, because their presentation is atypical and difficult to pick up.
Right. Let me also bring in Dr. Penny Negalur at this point. Are there any women-specific disorders that actually increase a woman's risk of heart disease also?
Yes, actually, there are traditional risk factors which are common to men and women both. But in women, these risk factors are very aggressive. And they could be diabetes and hypertension, dyslipidemia, and even obesity, or just decreased physical activity, just sitting. Sitting is known as the next smoking. And smoking itself is a risk factor for heart disease. And obesity actually is the mother of all non-communicable disease, including cardiovascular disease. But this is common to both men and women. In women, there are additional risk factors. For example, polycystic ovarian syndrome or pregnancy-related complications like having diabetes during pregnancy, known as gestational diabetes, or having hypertension during pregnancy, eclampsia, pre-eclampsia. These all actually increase the woman's risk for heart disease in the future. Even having a small birth of a baby can also predispose a woman to heart disease in the future. Now there are novel risk factors like cancer is also a risk factor, autoimmune disease is an additional risk factor, and depression and mental stress is becoming a big risk factor for heart disease in women. And you must have heard Lily just mentioned to you broken heart syndrome, which is due to a cardiomyopathy or involvement of the heart, which is secondary to stress. So women have double the risk factors compared to men.
Okay. But Dr. Lily Rodriguez, what about, the fact that we hear that estrogen actually helps protect women from heart disease? How true is this? Is there a particular age after which women then become more prone to heart disease?
Certainly estrogen, the protective hormone for women, is lost after the menopause, and the heart attacks are more common post-menopause or during menopause. But that doesn't mean that the younger women do not suffer heart attacks or any other heart disease. The risk factors are the same for all the women. We nowadays we always say sitting is new smoking. So nowadays the sedentary lifestyle, the junk food eating habits, and then lack of proper sleep or intermittent sleep, and then PCOS, which is also a very big risk factor, and then gestational diabetes, and all the complications of pregnancy like preeclampsia, and the other complications like hypertension in pregnancy. All these can lead to women for heart disease and particularly heart attacks in younger women. And nowadays in our country too, we do come across many younger women coming down with heart attacks. It is not at all uncommon. Just like men, men also come down with heart attacks in earlier age in our country, 10 years younger as compared to the Western countries. So this is predominantly because of the lifestyle that is changing in our country, and that is what we see more and more. Ankita?
Right. Dr. Rao, we've already talked about smoking being a problem, but, particularly for women, alcohol use and smoking, do these affect heart health directly?
So, Ankita, alcohol and smoking, both are major risk factors for heart disease. So let's talk about smoking first, because, smoking is what really hits the heart badly. So for a person who smokes, the risk of his having a heart attack or her having a heart attack is double that of a person who does not smoke. And why is that? Because smoking predisposed to increased rate of atherosclerosis, more deposition of cholesterol, more plaque formation in the coronary arteries, and as a result of which there's increased incidence of heart attack. Also, it slows the chemicals in the cigarette. It usually slows the flow of blood also. So people who smoke, they have increased risk of a heart attack, they have increased risk of atherosclerosis, they have increased risk of a stroke, which is a paralytic attack also. At the same time, they also have increased risk of peripheral arterial disease and abdominal aortic aneurysms. All of these are diseases in the arteries. So that's a major problem for people who smoke, men and women both. Also, now when we talk about alcohol, alcohol is something which, if it's taken in a very limited amount, it's okay, it doesn't harm you. So our American Heart Association says that you can't take more than 2 drinks in a week. But if you take more amount of drinks, you can have a condition which is called as alcoholic cardiomyopathy. Now, this is a condition in which there is damage to the muscles of your heart, and the pumping of your heart gets altered. So the patient can go into heart failure, and a host of other things can occur. So both of those things, not good for the heart at all.
Of course. Right. Dr. Negalur, what should a woman do if, she can feel she has symptoms that could suggest a possible heart condition? What would your advice be?
Yes, as you've already heard that symptoms of heart disease in women are very atypical. And so they are actually not even recognized by the woman. And even if she goes for a consultation, sometimes even the healthcare practitioner doesn't realize it. And they just label her as saying functional. And the difference is that these can occur during routine activity of daily living. Whereas in men, it happens after exercise, and therefore they rush to the practitioner. Now, even if the woman has an iota of doubt that she is having heart disease, she must seek help immediately. She must have a consultation with her physician and evaluate after a proper clinical examination all the cardiovascular system and do further tests of the cardiovascular system. She must get an ECG done, a 2D echo done, and maybe, as advised by the physician, even a CT angio. But she must also look for other risk factors that have caused the heart problem. Check her lipids, check her blood sugar, also check her blood pressure and all the other risk factors, and get herself evaluated and treated well. She must stop also smoking, and you just heard the hazards. And also women take oral contraceptive pills, which are high risk factors for heart disease, and therefore that has to be continued with the advice of the doctor. It is also important, to get their deficiencies treated, and regular follow-up. Regular follow-up is essential.
Regular follow-up essential. When we come back in just a moment, right after this quick break, we'll also talk about diets and much more associated with women's heart health. We'll be back in just a moment. Welcome back to this special program. We're talking about women and heart health, a subject that is perhaps largely ignored, certainly not given the kind of attention it really deserves. We've been talking to women health experts and cardiologists and diabetologists on the show. Let me go back to Dr. Sarita Rao at this point. Dr. Rao, are treatment protocols for heart attacks for men and women the same?
So, Ankita, when we talk about treatment protocols for men and women, the protocol remains the same. So, when a patient comes in with chest pain, the common thing which we do is this patient, an ECG is done, a cardiac enzyme is done, and if it's positive and we see features of a heart attack developing, these patients are loaded with some antiplatelet statins, etc. And then these patients are advised for either a thrombolytic therapy or emergency angioplasty is advised for the patient. So the treatment protocol remains the same. But the question is that are women getting these treatment protocols offered to them? So, there was a study conducted on almost 11 million women, and this was by the Johns Hopkins Research Institute. And they found that women consistently reported that they had received less level of care than men did. So it's very important we understand that a heart attack in a man and a woman is the same. Both of them require medication. Both of them require an angiography. Both of them require an angioplasty if it's necessary.
Right.
The protocol in treatment should not vary depending on whether you're a man or you are a woman.
Right.
It should be given same.
That's very important. Dr. Benny Nagalur, is there any difference between a diabetic heart and a non-diabetic heart?
Yes, actually, diabetes is one of the NCDs where the cardiovascular mortality is very high, and all the risk factors that we have just mentioned are more aggressive in diabetes.
Right.
More so, the heart attacks in diabetes happens at a younger age. So we are seeing, heart attacks at 35 years and 40 years, etc. Insulin resistance, which is part of type 2 diabetes, brings with it along its family of abnormalities like dyslipidemia, hypertension, obesity, and also PCOS and gestational diabetes. And therefore, heart attacks are most likely to happen in diabetic patients. But even in diabetes, men and women differ in their presentation of heart disease. One, we already heard the symptoms are atypical, but also in the intervention, you will see that, since women have smaller arteries and their microcirculation is involved in diabetes, they do not show the classical stenosis that you see on angiography in men. It is more diffuse in women, and most of the time they are sent back saying, okay, your angiography is normal and you are okay. And this was shown in the WISE study globally, which shows that many of these women who went for angiographies, actually 50% of them continued to have heart pain, and therefore this has to be this is important to realize. They also do not have the classical heart failure symptoms. Women have more of kind of preserved ejection fraction, which is also known as stiff hearts, whereas men have reduced ejection fraction, which is known as weak heart. So since the heart are stiffer, treatment is started later, and that's the difference between diabetes and non-diabetic hearts.
Right. Dr. Nagalur, thank you for that. Dr. Rodriguez, what is the best diet for a woman with heart problems? Should women in any way follow a different diet from men? Are there any specific precautions they need to take?
Yes, the diet does not differ for women or men post myocardial infarction or post heart attack. It remains the same for men and women. Ideally, most of the diet should contain vegetarian diet, vegetables, that too green vegetables, and pulses, and less of fat, and of course ghee should be avoided, and nuts, particularly almonds, and so the nuts are very good, but also the oils needs to be considered. The oils which are unsaturated fats, and keep rotating the oils. like rice bran oil and sunflower oil, and some like even refined groundnut oil. These oils should be rotated, and it should not be consumed always the same oils continuously just because they like it. So eating should be for health and not eating for the likes and dislikes of the individual post myocardial infarction.
Right. Dr. Rao, anything you would add in terms of a diet specifically for women with heart health in mind?
So Ankita, when we talk about diet, we also, we always want to say that the person should follow a healthy lifestyle. That is the first thing which, prevents heart disease, and prevention is better than cure. So if you can limit the amount that you eat, try to eat less than 80 calories in any meal that you're having, and concentrate on taking uncooked foods like fresh green vegetables, take fresh fruits. The less amount of oily and cooked foods that you take, likely you're going to be better off. And you have to take less amount of processed foods. We know that today even childhood obesity is on the rise. We know that all children, they prefer to have things like pizzas, pastas, fast foods. So avoid all of those things. Try to take fresh fruits, green vegetables as much as you can. Cut down oil in your diet as much as you can. Reduce the amount of calories that you need. As your body ages, your requirement comes down. So eating should just be very limited and to small amounts.
All right. Thank you all very much indeed for this very important discussion today on women and heart health. Lots to talk about, and perhaps for all of us, we should remember that the health of families and communities is tied to the health of women. It's very important to know about your specific risk for heart disease and, of course, symptoms to watch out for. We hope this program has kept you informed about all of these things. Thanks for watching.